Thank you very much, Resident Coordinator. And then I'm going to now yield the ground to Dr. Kechi Obuagu, who will give us the meeting objectives and the agenda.
Okay, thank you, Mr. Chair. And thank you all for the excellent speeches that have indeed motivated us and positioned us for the rest of the agenda today, tomorrow, and the day after that. I'm going to crave the indulgence of the very important dignitaries here when I say that from henceforth, perhaps there will be some greater degree of informality as the technical group work to deliver on the objectives of this meeting. So bear with us. We value your presence very much. We shall work very hard today and tomorrow morning and then present to the honorable ministers and all the distinguished delegates the results of our deliberation. So but please be with us as we continue to deliberate and learn as we move along. Let me just say very briefly that the major objective for this meeting, of course, you have the programs in front of you. So my intervention will be short, just so that everybody understands what we're trying to do. But you have the agenda before you, and I do not have a formal presentation, and you can look at the agenda in front of you on the table. The major objectives are very clearly there: to share information on the UN Commission recommendations and implementation plan, to share best practices amongst all of us, to review the draft implementation plan and reflect it, very important, in country priorities and needs, to develop milestones and targets for effective country, particularly country-level monitoring of implementation. And then we will also join Nigeria with joy in celebrating the launching of the Nigeria's Saving 1 Million Lives program. The heart of this 2.5 days deliberation are the countries here present. Many of us partners at the global and regional level and at all levels have worked extremely hard over the last few months to put together these recommendations and implementation plan. But now we have come to test it, in my opinion, to reality. We have come to nest it in country realities and in what the countries are already doing on ground. And as Dr. Patel led the agenda and the development of everything, his local organizing committee kept getting that message repeatedly. This is supposed to be country focused. This is the time to talk to countries, and this is the time to reflect, check reality and reflect their views within what is being planned. And in that line, the program is structured along those lines. There are many of us here showing the great enthusiasm that exists globally and locally for this particular issue. And so, but we're going to work hard, welcoming the large group, but also committing to delivering on the objectives of this meeting. I know many of us are passionate about that, and so I have no doubt whatsoever that we shall deliver. Immediately after this, we shall have two of us, some of the global conveners, presenting the recommendations. I shall introduce them later, and then the implementation plan. And now that I say that, perhaps forgive me, I haven't introduced myself. I'm sure you're wondering who she is. I am Dr. Kechi Obuagu. I manage and coordinate the UNFPA Global Program on Reproductive Health Commodity Security. I shall be your servant for the next 1.5 days. You're free to flog me if you things don't work out the way you would have liked them. But it indeed is a pleasure to be here. And so we shall have, immediately after this, my brief introduction, Mr. Opadai and Mickey Chopra introduce the recommendations and the implementation plan. We shall have respondents from WHO, USAID, and NORAD respond to their presentations. And then we shall have discussions, so any comments or discussions or inputs any of us on the floor may have. The UNFPA Executive Director will continue to chair for those two segments of the session. And then very important, our honorable, the excellencies here, the honorable ministers, and are going to issue a communique on this very important deliberations that's ongoing tomorrow during the ministerial segment of this session. And therefore, we show in the session that you see, 7:25, have some lead people come and discuss, put together a drafting committee that will work on drafting a communique for the ministers' consideration. And then we shall end the day with a panel discussion from all the countries present here today. They are aware of that and have prepared 55 minutes intervention each. And this will be from DRC, Ethiopia, Nigeria, Rwanda, Senegal, Sierra Leone, Tanzania, and Uganda. And then at the end of the day, we have a special treat where we shall have a representative from Nepal having a meeting immediately after this, presenting the excellent work they have done on chlorhexidine, and this will be in one of the rooms upstairs, and we shall announce this, so that as many of us as possible can go and listen to the wonderful work that has taken place recently in Nepal. Tomorrow morning, we will again very much work centered on the 8 countries here present, and work with them in groups, which we shall describe in detail tomorrow morning, on, first of all, the monitoring and accountability framework for tracking implementation at a country level. And then following that, with working with them again, many of them have begun work before they came here, but working with them on drafting what they see as the major recommendations relevant for them and the key methods by which they will indeed implement them. Again, the details of how that will work will be explained tomorrow, and you will have a guide to guide all the group discussions. And then the technical team that are all here will listen to the draft communique before the ministers, and get it ready for the presentation in the afternoon. And then that ends the technical segment of this meeting. After lunch tomorrow, we will commence the ministerial segment of this meeting. We will report back to the ministers about our deliberations today and tomorrow morning, and also again remind them about what the recommendations and implementation plan contains. And then we will hear from the honorable ministers the commitments of each country, their country commitments to the issue at hand. That will be the ministers and the commissioners, the honorable commissioners of the commission that are here present. That will be followed by commitments from various others, both national and international agencies, private sector, civil society, global level, who would want to make interventions. We have a few already nominated, but let us say that if there are other local bodies, for instance, who would like to make a commitment, they should please indicate to us so that your name can go into the program for that slot in the afternoon tomorrow. Development partners, some of them present, will also have an opportunity to express publicly their commitments to the agenda. We shall, towards the end of the day, also present the draft communique to the ministers, take comments from the ministers, and then we are hopeful that the ministers, after hearing the communique, will indeed adopt it so that it can be issued. And that indeed will bring to an end the 1.5 days of our deliberation, and the whole of day 2 would indeed take place at the government house here in Nigeria, hosted by the president himself. And the agenda for that is totally in the hands of the federal government of Nigeria. Expect great things, because this is a great country. Dr. Pate has assured us of that. We will all endeavor to be up as early as possible on Tuesday, because we have to go through security clearing here in the Hilton, and then be conveyed by bus to the government house. I will not go into trying to discuss the details of that program. We shall discuss it tomorrow when the need arises. Mr. Chair, distinguished ladies and gentlemen, I think this is a very brief synopsis. As each session is about to commence, we will provide more information. Thank you.
Thank you very much, Kechi. Can I call on Jagdish to give an overview of the Commission's key recommendations?
As Jagdish comes forward, let me introduce him very briefly, because I know he may not want to introduce himself, or perhaps will not do justice to himself. Mr. Jagdish Opadaye is the Chief of the Commodity Security Branch in UNFPA. Jagdish has indeed been a pioneer and has been in the forefront of leading the movement globally and nationally in many countries on the issues of reproductive health, commodity security, family planning, maternal health, and many other issues. For him, he lives and he breathes these issues. Commodity security, he was one of the pioneers who conceived that terminology, and today it is a household name everywhere. Those of us who work with him in UNFPA know that that is Jagdish's life. And for us in UNFPA, we know that whatever strides we have indeed made in this area, a great deal of it has been as a result of the tirelessness and passion and leadership of Mr. Opadaye. It is indeed a pleasure to introduce him.
Thank you, Kechi. Kechi works with me, so this introduction was a bit more. I'm feeling a little old right now. Honorable Chair, sir, it's difficult to address your own boss as Mr. Chair. Honorable Ministers, particularly Minister Pate and your team, I salute you for the wonderful work that your team has done to bring us here. It is almost like a dream come true for us. We worked very hard to bring the Commission recommendations, but I think the time has come that we work with the countries to see that how this recommendation will work at the country level. So this is the time that we will see the validity and importance of this recommendation, how we carry on. UN resident coordinators and all other dignitaries, protocol observed. The Commodity Commission is supporting the UN Secretary General Global Strategy, saving life through improving equitable access to life-saving commodities, and it's a part of every woman and every child work. What are these commodities? Basically, we are talking 13 overlooked commodities and a specific 10 recommendation. You must be wondering why such a big Commodity Commission only for 13 overlooked commodities, and why you are talking only 10 specific recommendation. I'll tell you, I was talking yesterday with country delegation, and they told us that we are happy to see that the continuum of care, and also the talking of maternal health and child health, is done together in this commission work. And that's all about it. It's not a vertical program, but it's how the Commodity Commission brings together the continuum of care. We are talking, as in the opening statement, my boss and Executive Director of UNFPA said, it's about MDG 4, 5, and 6. If the global health will not make the progress, then MDG will not be achieved. So it's very specific recommendation targeting to save some 6 million. The impact of this work will impact on in reducing 6 million lives, the impact of saving 6 million's life with these 10 specific recommendations. And these recommendations are on 3 cross-cutting areas overall, and they are related to market shaping, performance and accountability, and innovation. And I will deal with these recommendations briefly later on. So the impact, I said, this 10 non-family commodity could save 6.2 million women and children, and with estimated cost of 1.3 billion. And additionally, family planning work can save, can have impact on maternal health as well. So it's 1/3 of maternal health can be reduced. And there is already work, London Summit, that we heard. We are talking about 120 million additional women by 2020, and that will have impact on 300,000 fewer women and 3 million fewer infant deaths with the cost of approximately 4 billion. So this is all coming together. And additionally, family planning can save 100,000 maternal deaths every year. So these are very specific, very targeted work that the Commission has started. What are these commodities? These are in 3 different areas we divided the commodities. One is the region we selected because they are very high impact and very effective commodities, because there are inadequate funds, and that there is a very untapped potential for increasing access of these commodities. So that, I will not read all the description, but the high impact, inadequate funding, and potential for life-saving. I think these were the 3 main reasons for selecting those commodities. The list is here. It's surprising that some of the commodities like oxytocin, magnesium sulfate, misoprostol and others are still scarce, and it's a low-cost commodities. It can save lives. I have seen personally visiting many countries. When you go to the district level hospital or peripheral level hospital, some of these commodities who are very, very low cost are not available, or people are not properly trained to use them. And their formulation is also wrong in many times. The same way family planning commodities and children health commodities are there. We're still talking ORS. I mean, when we talk in many countries, these are very, very low cost commodities which can save women's and children health tremendously. So when we selected these high impact commodities, we looked at the different, the whole implementation plan and what should be done. We came across 10 recommendations. 5 recommendations are more broader level, global level recommendation. For example, shaping the global market. Just to give you an example, some medicines are low cost, but if you aggregate and then you manufacture in a quality manufacturing is done, then you can reduce the price, you can find a better quality product. Some are related to financing and some are relating to registration, quality and all those things. So if we can have the quality product and manufacture in a quality way with a quality standard and aggregate demand, I think that we can supply to all countries in better quality in more coordinated fashion. There are other recommendations related to in-country like supply and awareness related, demand and awareness creation, and performance, reaching women and children in performance, and also innovation. So if we look at all those 13 commodities and divide these recommendations and see that what has to be done to improve the accessibility of these commodities to everyone who needs them. Based on those 10 recommendations, we also develop our implementation plan, and that's what we are going to discuss. And for each recommendation, there's a recommendation plan. So for example, if market shaping or market dynamics is the work that we need to do, then we have to see that how do we aggregate demand? How do we see that forecasting is done properly so that you can negotiate with the manufacturer? If the issue is related to, for example, registration, then how do we see that these medicines are part of essential medicine list? And the regulatory authorities are properly trained, they have a proper lab to test them, they have all the equipment and the product are coming in the right quality and they are safe. Although issues related to formulation and the packaging and all those things. But also importance is how do you increase the demand of those products, how people are trained to know that what kind of doses are given to the needy persons. Issue related to best practices, we are in computer age and, do we have something innovative to know that what is happening at the country level, both in terms of demand and supplies. Communication, and related to establishing indicators and a scorecard and other things to see the performance and monitoring. So those, the recommendation and what could be possible implementation is, they are highlighted at the global level. But now what we are doing here is weighting those recommendation and implementation and saying that if these are the issues that we found by working with you at the country level, what countries should do to implement these recommendations, and how country will look at this recommendation. Are they in the country context? How they will drive it? Is that under the country leadership? So we came here to learn from countries, to hear from their government leadership and countries' leadership, to see that how this recommendation that was submitted can be implemented at the country level. And from UNFPA side and also from UNICEF, we will work together to ensure that these recommendations will be implemented as per your country context and as per the thing that you decide which will be appropriate. So we are more on the listening mode in next 2.5 days and see that what will be your priorities among these implementation and how we can move quickly in the short term and also for the longer term. So if we come to the next steps, I think what we need to do is to look at the country plan and priorities, that what the countries will plan and how they will prioritize, how country will make the commitment to move on these things and how that commitment will be translated. That will be our next steps. Then we will also have to discuss on monitoring and progress. How do we monitor? Because if we just leave the implementation as it is and will not discuss with the countries, I think what has to be done is the monitoring and see that how in next 6 months or 1 year and next 2 years what has to be done. And how do we communicate both, not in terms of only advocacy, but how do we communicate it from the country level to also to the global level to connect the different dots from the manufacturing side, the market shaping side, and the country level work. Sometimes country needs are not such a volume that how the demand has to be aggregated at the global level and can be supported at the country level. So all that communication line has to be established. But I'm so happy that this work has come together and it's in such an integrated manner that we all together in the health areas, both for maternal and children health, and seeing that at the country level, how country becomes the focus, how we all support the country, and how we place that our commitment of MDG will be met when we are all together. It's the one voice that we are pleading for it. Thank you very much.
Thank you very much, Jagdish. And let me call on the representative of WHO to respond as a respondent.
Yes. May I introduce Dr. Michael Mbivo, who is the UNFPA, who is the WHO respondent. Well, you can join UNFPA, we will like that. Dr. Mbivo is the Director for Reproductive Health and Research at WHO office in Geneva, and his portfolio also, of course, includes HRP, which is co-sponsored by UNDP, UNFPA, WHO, and the World Bank. He has been with WHO for the past 16 years. He has had extensive country experience. Before he came to this position, he worked as the coordinator for technical support to many countries supported by WHO, and was manager for the men's reproductive health. That is an interesting change. Prior to joining WHO, he was a research director and professor at the University of Zimbabwe Medical School. Dr. Mbivo.
Honorable Minister Pate, my colleague, Executive Director of UNFPA, Dr. Babatunde, who has also just recruited me back to UNFPA. Distinguished guests, colleagues, ladies and gentlemen, it really gives me great pleasure to be here to share in the deliberations of the next few days. I'm here really to echo what my colleague Jagdish has said, and to say this is how we can collectively respond to this critical gap. I think what has happened here, when I look at the establishment of a commission on life-saving commodities for women and children, somewhere, somehow, someone realized, either individually or with others, that there was a critical gap, that there are issues that are emerging, that we are continuing to lose the lives of children and mothers, and we are failing to ensure that they have equitable access to these products. So we are deliberating on how we can ensure that we have commodities, we have products that are efficacious, that are effective, that are of good quality, that are safe and are acceptable, and can simply address those critical gaps. So really our deliberations for these next few days, in particular at the technical level, is to be innovative. The Commission has laid out the recommendations. Our leaders have identified the commodities that still require action. How can we translate those recommendations to ensure they can have a meaning, a tangible meaning to the lady, to the woman, to the child out in the village? That is where the challenge is. How we can ensure that we have tangible outcomes that can translate into saving lives. Otherwise, it becomes part of the rhetoric. On our part, within WHO, we are working as part of the H4+. We are also working with development partners and indeed with countries to say, let us take into account our comparative advantages. Let us harness our collective strength and come up with what we can do to make a difference. Just looking in terms of what WHO can do, we did take up recommendations 4 and 5, for instance. We also took up the issue of emergency contraception, strengthening quality, looking to ensure that we can have products that are pre-qualified, but even within that pre-qualification to ensure it can be done or expedited in some way. We also need to look into local manufacturing, how we can work together to strengthen capacity so that we do not get adverse events reported with some of the drugs. Already here in Nigeria, for instance, we are working with 8 manufacturers. And amongst the products we are working with them are zinc, amoxil, some of the products which are included in the list. How can we at local levels, at regional levels, harness the comparative strength available within these manufacturers so that we can have common dossiers? We can submit common dossiers that do identify some of the issues and come up with products which we can attest in terms of quality. That is critical. Issues of quality, issues of efficacy, issues of safety of products. My colleague Jagdish has already talked about country implementation plans, monitoring and evaluation, communication, but there are also other issues that relate to that. Innovation in our advocacy. If we are going to be advocating to ensure that we can take these products at country level and scale them up to ensure that equitable access, there is also the need to ensure that our approaches are innovative. So I join colleagues in UNFPA, USAID, UNICEF, the bank and others in committing and dedicating to see what contribution as WHO we can make. We try to be in every country, and the H4 partnership is even strengthening our presence, and we have projects and programs which are being funded and channeled within the H4. So this could be one of those which can show the leadership, where some of the efforts or recommendations which are coming out of the guidelines we produce or from the research publications, we ensure that those recommendations in the guidelines are supported by the commodities which are essential to saving lives. I thank you.